Hi everybody, welcome back to Bread and Butter Primary Care. I'm Dr. Stokes. If this is your first time joining us, welcome. A little review of what this channel is all about. This is a set of short, simple videos that I'm making, mostly targeted to providers in training, medical students, PA students, nurse practitioner students, new residents. Just going over simple, brief videos to help give you just the right information to help you do the bread and butter of primary care. So we're talking about the stuff that you see day in and day out as a primary care physician that'll help you as you start getting ready to increase your skills. I've done a whole set of information on blood pressure and am now going to do a set on actual history taking and getting information from patients. So I'm looking forward to talking about that. One thing that I tell my medical students and the PAs and things that I work with, there's nothing more important that you can do as a medical provider than get a good medical history. By far and away the most important thing you can do. And the first part of that history, the HPI, the history of present illness, is by far and away the most important thing. And the great news about that is you actually need zero medical knowledge and experience to take a perfect HPI. You don't have to know what the answers mean. You don't have to know what's going on. You don't have to be able to form a differential. All you have to do is ask the questions and record the information. If you know what questions to ask, you're going to get a good history for a whole variety of complaints. You're going to be prepared to talk to your preceptor. And when you're first starting, if you're in your first rotation, you're just starting your preceptorships and you're just starting to interview patients, I know it can be stressful and it can be worrisome getting ready to go and talk to your preceptor. And a lot of times you're thinking, I don't know what to do, I don't know what this is, I don't know what the differential is. You're way ahead. You're way ahead of your time. If you're brand new, just starting, if you can collect a perfect HPI and give your preceptor a perfect HPI, they are going to love you and they're going to think you're doing great. The other stuff's going to come, and we'll talk more about that in other videos. But let's talk about this as we do this video. The mysteries in the history, HPI, and review of systems. Okay, so the HPI is the history of present illness. It's a description of the chief complaint, whatever the person is coming in and complaining about. The questions you ask are the same regardless of the chief complaint. You can stick to the same questions and you're going to get a good history. There are several mnemonics that help people remember what questions to ask. Old carts is one I hear my students refer to a lot. I never used that one, so I'm not that familiar with it. I used OPQRSTA, so it's just alphabetical starting with O, except for the A at the bottom is obviously not in alphabetical order. It's not a perfect mnemonic because there's different numbers of questions with every letter, and so it doesn't work out perfectly, but I'm going to go through that one. Regardless of what mnemonic you use, if you know these questions and you ask them every time, you're going to get a great history and you're going to be doing great things. So I've got it written down here. This is how I lay out my HPI. So OPQRSTA: onset, palliate, provoke, previous and progress, quality and quantity, region and radiation, severity, treatments, and associated symptoms. Okay, so not that many questions. That's it. If you ask all these questions and you record the answers in a kind of sequential way, you're going to have a great story to tell your preceptor, and you're going to have a very good sense of what the patient's got going on and what you need to do just with this information. And like I said, all you have to do is memorize those questions. You don't have to know anything else. So when you're first starting out, you're going to your first patient, take comfort in that. Anyone can take a good HPI. You don't have to be experienced to do it. So let's run through a kind of sample HPI using this mnemonic. So we have a patient coming in and they have chest pain. Very common symptom. And I like this one as an example for the power of the HPI because chest pain can be something that's very dangerous, like a heart attack, and it can be something that's very benign, like a pulled muscle. And which one it's going to be is going to depend on the answers to these questions. So this is what it would look like. So you have a patient coming in, they're saying, hey doctor, I'm here and I've got some chest pain. When did it start? What makes it better? What brings it on? What makes it worse? What makes it go away? Has it ever happened before? And is it progressing? Is it worse now than it was last week? Is it happening more and more frequently? Things like that. Quality and quantity. How often does it happen? Where, how often, how much, those types of things. Region and radiation, where are you feeling the pain? They can point, maybe it's the left side, maybe it's the right side. Does it radiate anywhere? Does it go anywhere else other than where you're indicating? How bad is it? If you could put it on a scale from to just barely notice to excruciating, where would you put that? What treatments have you tried? Do you have any other symptoms associated with this? So those are the questions that you would ask. And with those answers, you're going to have a lot of great information. And so, as you can see, I don't have to know anything from a medical standpoint to be able to ask those questions. It's simply, when did it start? What makes it better? What makes it worse? Has it happened before? Has it changed since it started? Describe it for me. Where is it at? How bad is it? What treatments have you tried? Are there any other symptoms that go along with it? Those types of things. You can collect that HPI in just a few minutes, and you're going to have a lot of great information to go off of. So, number one thing, most important thing you can do is know those questions. And when you walk into a room and you're thinking, I don't know what to do, I'm not sure, just take a deep breath and just say, hey, all I have to do is ask the HPI questions. With that information, I'm going to have a good sense of where I'm going and what I'm doing. Okay? So that's the HPI, number one thing, most important thing you can do in starting to manage and help a patient with their medical problems. I hope that's helpful. Stay tuned for the next video. We'll be talking more about the review of systems and other history elements and how they play into that. And otherwise, I hope you guys have a great night.